said, I've been involved with marine mammal research for the last 6 years. And how this started, it was with the Navy Marine Mammal Program, getting funding from the Office of Naval Research and the Department of Defense to do viral discovery on marine mammals, especially on the dolphins and sea lions that are part of the Navy population. This was a collaboration between Hubs, Seaboard Parks, the University of Florida, and we had developed over 30 PCRs and validated them to look for these viruses, and we found about 50 of them. Now, when we find one, it's like, you find herpes, you have type 1, type 2, so you have different strains. The same thing that happens with Calisi, you have the class species. Some of them have been published, some of them are on the work. Now, when we started finding these viruses, we realized, well, we got to do risk assessment. We want to figure out if there's a significance of this virus in the population. And so we reached out to stranded networks and collaborators like the Marine Mammal Center, Chicago Zoological Zoo, and others, and collected samples not only from the managed population, but also from the wild. And while we were doing this risk assessment, we found out that there were several clinically significant viruses. As you can see on the bottom, we have the dolphin parainfluenza virus, we have sea lion astroviruses, we have San Miguel sea lion virus, and enteroviruses, all of those related to episodics. And then we also came across a parrot herpes virus that was in one animal with Biston lymphoma and esophagitis. The Marine Mammal Program has a unique population. The program has been around for about 50 years, and it has 80 dolphins and 40 sea lions. Now, it is a very, very special population, and it is the second largest managed population of dolphins in the world, the first one being SeaWorld. They live and work in open oceans, and like wild dolphins and wild sea lions, they interact constantly with the microbes in their environment. Thank you. Like Cynthia mentioned, and you know already, most of you, they go through extensive health assessments. So most samples are sent out for blood work, and that data is available digitally. And there's tens of thousands of samples that are archived at the Navy. So this is one of the things that excited me the most when I started working with this group, because I came from the human virus work. So I was working with HIV, hepatitis C, papilloma, and when I was trying to do studies on antibody titers and viral loads, it was very hard to do time series and to correlate them with disease. Now, when you have a population that is well managed like this, and you find a virus or a pathogen, then you can call the Navy, and then you can call collaborators that work with animals in the wild, and find samples that you can do time series and correlate the presence of the pathogens with disease, and then go out and look for these in the wild. Now, not only we work with emerging infectious diseases, or can use this population, these samples, to look for emerging infectious diseases, but also metabolic diseases. I think Steph is going to talk a little bit about those, and some of them will be diabetes and Alzheimer. I am currently doing a 2-year postdoc through NRC, and the funding is coming from DEFRA. And the idea is to look for ocean-borne pathogens that have the potential to cause pandemics in humans. Now, for the last few months, I've been just doing lead searches, and I've been learning a lot about emerging infectious diseases in marine mammals and also in terrestrial mammals, and trying to put that information together. Now, as you can imagine, this requires me gathering a big group of experts that I can rely on to assess the likelihood of these ocean-borne pathogens to cause pandemics in humans. After that, we will conduct small proof-of-concept studies, and the idea is to develop and publish a 5-year investment strategy. Now, some of the working group members that we have so far belong to the CDC, Columbia University, Mayo Clinic, Stanford, Florida, among others. So we have a strong group to get started with, and as you've been hearing, we are going to be reaching out to you. I mean, this morning alone, I've learned so much about benefits. When you start working on viruses, and something that was mentioned during lunch is like, if you love sea lions or if you love dolphins, you better learn about fish. Well, it just started with me loving viruses, and all of a sudden I have to love marine mammals, and I gotta learn about what they prey, I gotta learn about their migration patterns, so I have a lot of reading to do. I need some help. As Cynthia mentioned, the foundation takes care of the health of the animals, and it has, along with the medicine program, a One Health program which targets the intersection of animal research, marine mammal research, and human health. A group of experts have gotten together and evaluated, the presence of emerging infectious diseases in marine mammals. And they got the lists that are of pathogens in the CDC and found out that 37% of emerging diseases and 20 reportable diseases were also found in marine mammals, and nearly 50 of those are zoonotic. So it is important for us to look at the emerging infectious diseases arising from the ocean. Now, this article also shows that the rate of spread in the marine environment is way faster than the spread on the land. So that's something else to consider, and that's probably because of the water. Putting all of these together, we've been working on developing a list of high priority pathogens to assess the potential impact to marine mammals, the economy, and public health. So to be included in the list of organisms that we're looking at, the organism had to be a bacteria, a virus, a fungi, or a protozoa. It had to be published in peer-reviewed literature as a microbe identified in sea lions, sea otters, seals, or small cetaceans. There had to be more than one example of spillover, and that the organism is pathogenic in marine mammals and or well established in marine mammals with known concern to public health. Now, the pathogens were prioritized based on a total possible score of 16 when addressing the impact of marine mammals, public health, and economic interest. The pathogen was given a score of 1 to 4 based on if it affected sea lions, sea otters, faucides, or small cetaceans. Scores of 0 to 1 were given for illness, mortality, episodic, and a score of 2 to mass mortality because, that's bigger. And the pathogen being zoonotic on the CDC emerging or notifiable list of agricultural interest or having a potential to be found in the ocean and land were also scored. So from 50 pathogens on that list, we are concentrating on the 15, the accent there, 50 pathogens in the list. We're working with 15 that have the highest score. There, it's a little better. So you can see that the ones that are on the top tier are pathogens that you're probably used to hear about, like Brucella, influenza, caliciviruses. And then when we move a little further, those should still be familiar to you. Or viruses, staphylococcus, including MRSA. Now, a common question. A common question that we come across is, well, is there really an opportunity for exposure? And I know that in this room we're going to go and say, oh, yes. In the US alone, there are 151 institutions responding to strandings. There's more than 26,000 marine mammals stranded in a decade, and an average of 4 to 5 unusual mortality events per year. So the public is exposed when the animals wash up in our beaches. Marine mammal stranding workers are exposed when responding to these stranding, and Judy is exposed when performing necropsies, because she's very careful. And all of these events expose the humans and the marine mammal workers way before we even know if the animal is infected with the pathogen or knowing anything about that pathogen. Another source of exposure is human consumption of marine mammals, and that might not be something that we think here in Southern California, but it's something that we have to consider in places like Alaska and Japan. Now, let's talk a little bit about a few of these marine mammal emerging infectious diseases. We have Toxoplasma gondii. It is the leading cause of death in sea otters, and studies show that over 72% of the T. gondii positive southern otters from the coastal California area were found to be infected with this non-archetypical toxoplasma that has been called strain X. Now, this strain was also found in coastal dwelling felines, canines, marine bivalves, supporting the hypothesis that feline fecals, so cats are the ones that are the definitive host of this protozoa, the fecal contamination is flowing from land to sea through surface runoff, and that otters can be infected with Toxoplasma gondii by consumption of filter-feeding marine invertebrates. Now, Toxoplasma commonly infects marine mammals, causing central nervous system impairment, behavioral changes, abortion, and fetal or neonatal death. It is most often transmitted following ingestion of contaminated food or water, and can infect essentially any warm-blooded vertebrate, including humans. So that makes Toxoplasma gondii the world's most successful zoonotic parasite. Talk a little bit about caliciviruses. The marine environment is central in the ecology of caliciviruses. Salmonella lion virus, the calicivirus of the genus Piscivirus, is one of the most commonly reported viruses of marine mammals, and it causes vesicular lesions in pinnipeds and has been suggested as the cause of episodic gastroenteritis in California sea lions. It is genetically indistinguishable from vesicular exothema in swine, again the accent, which is considered reportable for animal disease. Sandy Gale sea lion virus has been found to infect fish, amphibians, reptiles, and primates, and there is evidence associating Sandy Gale sea lion virus with hepatitis in humans. The apparent ability of some caliciviruses to infect such a wide host range suggests that further studies are definitely needed to understand the ecology of these viruses, which might be relevant. You've been hearing about lately, there was a recent episode of pneumonia in New England of harbor seals, and that has been caused by an avian flu virus. And this was on the news because it's relevant. It's again an avian influenza virus that has the capability to infect mammals. And since humans are mammals, it puts us at risk as well. And mass drownings have been attributed to influenza virus, and they have been reported in both pinnipeds and cetaceans along the New England coast. Postmortem examination of infected harbor seal carcasses and contact with symptomatic animals has resulted in zoonotic transmission of 4 marine mammal workers reported in 1981. Now, what I found really curious, and it's not the only time that I got to read about this, is that those marine mammal workers that were exposed to this avian flu virus didn't necessarily develop pneumonia-like symptoms. They developed conjunctivitis. So that's something for us to be aware of. Even though we're talking about the same pathogen in different hosts, the disease manifestations might be different. The disease signs for influenza virus include respiratory distress, lethargy, swelling of the neck and conjunctiva, incoordination, and frothy white or bloody nasal discharge. Last but not least, we have marine mammal brucella, associated also with infections in humans. It infects a wide variety of aquatic mammals, including pinnipeds, cetaceans, and the European otter. Clinical disease most commonly consists of neurologic and reproductive signs. Transmission to humans may result in influenza-like illness, chronic disease signs like arthritis, and in rare cases, neurologic disease. Now, we would easily be able to give a worksheet just in each pathogen, so that's why we have to go so far. And another thing that you notice is that at first I was very comfortable just talking to you. When I got to the pathogens, I actually have to read my notes because there's so much information out there. And there's bits and pieces that are still missing, and that's why we need to reach out to you. Again, I started with viruses, then I have to get interested in marine mammals, and now I have to be interested in their prey and migration patterns, climate changes. So there's a lot of information that we need to put together to properly assess the importance of these emerging infectious diseases in marine mammals. One last thought that I thought I would put there for you guys is healthy oceans benefit the animals and their people, that's us. And that's why it seems that projects like the One Health Ocean Index, I'm thinking acronyms, the Ocean Health Index is so relevant because it's a way that we can start putting together and then we can start adding to that. And that's it. We would like to